So any quick questions or any doubts you have related to Causative? Okay, see, in case if you have no doubts, now how do I get the clarity you have no doubts? So I'll ask you some questions. Okay, so what is Causative all about? And what comes to your mind whenever Causative remedy is told? What is it? Autumn dysentery, very good, agreed. It is a remedy affecting the small joints. Rheumatism of small joints, and indirectly we also concluded it can be a very good remedy for gout. And I gave you a small information in the last class. Before it was proved homeopathically, allopers were using it for gout. So allopers were using it for gout. Okay. Yeah. Anything else? We also spoke of the GA affections, the gastric complaints. What was nausea? Very good. If you remember, I shared a small case where we had prescribed it to a lady during her pregnancy for morning sickness. So beautiful remedy for nausea. Now, how is Causative different from other remedies? How is Causative different from other remedies? See, nausea, which are the other remedies? Arsenic amol, very good. Arsenic amol, then other remedies for nausea. You also have ipecac. Is ipecac done? No. So at least the remedies that are done, arsenic amol. How is it different from arsenic amol? Sight, smell, and even thought. Very sensitive nervous system. The sight, smell, or even thinking about food can bring on nausea in Causative. Very, very characteristic of Causative. Okay. You also had this situation in arsenic amol. Yes, I appreciate. Okay. Then talk about Causative. We also saw that what happens to the abdomen? Bloating. What is the speciality or peculiarity of bloating in Causative? They feel as if abdomen would burst. Right? Many remedies are there for distension of abdomen, for gastritis, for flatulence. So this is the remedy where you think of is this is the remedy you think of for distension. It's so bad that they have a feeling that it will burst. Good. Anything else? Okay, complaints which come up because of suppressed foot sweat. Okay. So we missed another important area in Causative. We forgot to mention about the urinary complaints. What you saw is there is inflammation, there is retention, kidneys are not functioning properly, so urine becomes concentrated. Urine becomes sedimentous and then it can be inky. Dark, inky urine. Never forget this situation in Causative. Chronic nephritis, okay, and other things, okay. Yeah, we'll go ahead, we'll continue with the, see, it gives me some clarity that, you have understood Causative. So the prime area in Causative will be the GA, of course the joints, the kidneys, and we also mentioned a little about the mind of Causative. How are they? There was an ailment which indignation and sadness. What brings on indignation? What brings on sadness in Causative? Wrongdoing. Somebody is doing something wrong and they cannot see it, they cannot bear it, and they become agitated. Okay? Indignation. Beautiful, good. So, I again have a small situation. Before I start a remedy, I am just giving you a situation. It can be imaginary or it can be real. Okay? Because it's a first year class. This situation is very simple. You have a 30-year-old lady, okay, coming to your clinic tomorrow with watery stools. So she has this complaint of watery stools and she needs medicine, and that's how she has landed up in your clinic. Hope this situation is clear. Okay? And again, I am making things very simple, very easy. please read this carefully. As a first year student, what remedies come to your mind? Before you start answering, I know you are only 6 or 7 months into homeopathy. So not many remedies. How many months? Almost a year. 11. Very good, very good. Anyway, Mubarak, congratulations. So what I was trying to tell you is, your journey is very short and there's a very long way to go. So keeping all those things in mind, I have just given you a very simple situation and I want you to come up with some simple remedies for this particular condition. What are the probable remedies? Very good. Sulfur, aloes, must be. I have the same remedies in mind. Yes, very good. Aloes, and we are also talking about sulfur, cinnamon. Beautiful. Please make a note of the remedies that we have given. And if you are interested, we will take up the key points. Diarrhea, how is it in aloes? How is it in cinnamon? Then somebody was talking about sulfur. Beautiful, good. So, aloes, when you said cinnamon, I said chamomilla. Okay, chamomilla, we'll think of chamomilla. Sulfur. One more simple remedy for diarrhea. Very good. Colchicum, good, beautiful colchicum. Delcamoria is there. Carbamide, yes, it's there. The only thing is you should name the remedy. I will give you the indications. Don't worry. Letter? Okay, letter. I made a mistake telling you. Give the remedies. Okay, chalo, letter. Okay, we'll come to it. Letter. Colocin, yes. Somebody is making a note. Colocin, colchicum, carbamide, and of course sulfur, chamomilla, cinnamon, aloes. One simple remedy you missed. Very good. Apis mellifica. Apis mellifica. I am talking to you about simpler remedies. I mean, the lady coming to you with water stools, Who is that? I had a boy telling, arsenica malva. You all agree with this? Yes or no? Arsenica malva. Okay, I'll come back to arsenica malva. And of course, many remedies that you have told. Okay, we'll get back to aloes. Your attention and your interaction is very, very important. Okay. Now, when aloes, as you can see, please keep this situation in your mind. She is a lady aged around 30. Okay. Now, when do you think of aloes? Very good. You are getting my point. See, the beauty of this particular system. For other systems, it will be one antibiotic or something. But see the difficulty we homeopaths will be having. One disease condition, we have many remedies. And it is our duty to match and give the right remedy. Okay. So when can you match and give the right remedy? When you know about the remedy. And this is the small task we are taking up. Okay. Small practical task we are taking up. If it has to be aloes, then aloes will have early morning diarrhea, absolutely right. Anything else in aloes? Mucus. So you are talking about the character of stools. The character of stools in aloes will be mucus. Jelly-like. Very good. Jelly-like mucus. Any other information in favor of aloes? Early morning. Now what is very peculiar, very loss of confidence over sphincter breathing. Loss of confidence over sphincter breathing. Now this is something very important, if you remember. Aloes, patient concentration is always on the sphincter breathing. Why? If he is letting this loose, then stools will escape. Okay. The ligaments, the muscles, the nerves, whatever are involved as per your anatomy, they are all in a very fragile state. And if he is letting his concentration out of that, stools will escape. Now that is the embarrassing state the lady is in aloes. Stools escapes with flatus. Patient is feeling is passing gas, but what is also getting escaped with gas is the stool. No control. Go back to physiology. No control. On the sphincter ending. Very good. Aloes. Early morning diarrhea. drives him out of the bed. Allows. Good. Now the second remedy you told was chamomilla. Huh? Okay, fine. So assuming she's a 30-year-old lady, fine, and your input, ailments dentition from, we will roll out chamomilla. Okay, fine. See, but one of the ailments of chamomilla is dentition. Chamomilla can also have other ailments, and chamomilla can also have a typical characteristic stool, greenish. So you have a lady who comes to your clinic with colicky pain, greenish, chopped, very irritated, very cranky lady. Okay, you can still think of chamomilla. Good. Then somebody was talking about cinna. Again, the 30 years might be a little confusing. But what is that you have in cinna? Okay, yes, complaints due to worm infestation. Yeah, when they are passing undigestible food, when they are also passing worms. Child, patient is passing round worms, diarrhea, very cranky, very irritated, keeps rubbing nose. You can think of cinna. Then all of you are clear. And then you also told me about colchicum, a remedy which we recently did. Now what happens in colchicum? Is it diarrhea or something else? Yeah, in colchicum good. In colchicum you will have more of dysentery. What is it? Colchicum you will have more of dysentery. And what is the character of stools? Acid, scraping of intestine. White, mucousy stools. Colchicum. Okay. And somebody was talking about sulfur. How is it in sulfur? Yes, early morning diarrhea, you also have it had in aloes. But the beauty in sulfur is, it has to literally it drives him out of the bed, and many times he might also lose control over the stool and he may soil himself. Now what is the hallmark of sulfur? Huh? Very good, burning, I appreciate, good burning. Apart from burning, in diarrhea, the odor, bad smelling stool, and even if the person has washed himself well now, when he is coming out of the washroom, you can also smell that kind of thing, or the patient might also start smelling. Sir, I have gone, I have washed, but still I have that stool smell. Okay, fine. So very offensive stool, burning, early morning, dirty, sulfur, good. And then the other remedy is arsenicum alba. Now you are telling something. Odor which is offensive. Watery stools, bad weakness. Please remember, arsenic will have a lot of prostration. Arsenic will have a lot of restlessness. So prostration, restlessness, and what is the important reason why they had diarrhea? Okay, after cold, what else? Huh? Yes, very good. After eating decayed food. I have repeated in many classes. Arsenic, yes, one of the top remedy for food poisoning. One of the top remedy for food poisoning. You should not forget arsenic. So, arsenic has food poisoning, okay, and arsenic has watery, offensive stools like that of cadaver smelling. They all used in arsenic. More remedies came up. Bryonia, is Bryonia done? No issues. But do remember, Bryonia is a remedy for summer diarrhea. What is it? Bryonia is a remedy for summer diarrhea, and Bryonia also has early morning diarrhea. Okay. One of our friend here was talking about carboways. Yes, good. Carboways. Carboways is also similar to arsenicum alba. Okay. But diarrhea in carboways will come up after eating decayed fish. You are getting the difference? What is the difference between arsenicum alba and carboways? Arsenicum alba, I mentioned decayed food. It can be any damn thing. And carboways, it is specifically decayed fish. Ketto mino, tinda nantra. If you have diarrhea, again cadaver smelling, fine, bad smelling, offensive, you can think of carboways. Lot of prostration, lot of debility, carboways. Okay. So good, keep it up. Lot of remedies we have discussed, you have given me a lot of inputs. Appreciate. Today, I am adding one more remedy. One more remedy which predominantly has action on the lower bowel. Okay, what do you understand when I say lower bowel? The lower intestine is the rectum and the ana. So a remedy which predominantly acts on the lower bowel. Okay. So that remedy is Podophyllum peltatum. Next 40 minutes or 1 hour. Is this done? No. When you are all happy, I thought it's done. Okay. So a new remedy, brand new remedy that we'll be discussing for next 40 minutes or 1 hour. It again depends how much you want to interact, how much you want to talk. Based on that, we will decide. So the remedy that we are going to discuss is Podophyllum peltatum. This is the remedy. Okay. And being a first year student, integrating the subject pharmacy, we will be looking at few pharmaceutical aspects of Podophyllum. And then we will be integrating anatomy and physiology in the next component. Okay. So we look at Podophyllum and it's got few common names. You are a first year student. There can be some Viva questions coming up. What is the common name of Podophyllum? Which family it belongs? Who proved? These are questions that can come up. So, May apple, Indian apple, ground lemon. These are few common names that you get from your source books. Okay. So moving ahead, natural order. To which family Podophyllum belongs to is again very important. It belongs to the family Berberidaceae. What is it? Berberidaceae. So you have a few more remedies from the same family. Berberis vulgaris. Must be in future somebody will be talking. Okay. So natural order, and then the part that we use in Podophyllum is the tincture of fresh root. The tincture of the fresh root is what we are using. Okay. Hope this is clear. Very simple. And basically, you see Podophyllum growing in US, America, United States of America. Okay. And the credit for proving this particular remedy also goes to one doctor from United States, and he is Dr. Williams. Okay, he is Dr. Williams. Now we'll unfold the picture. This is how Podophyllum peltatum looks. Very small plant. It grows some 2 to 3 feet above the ground. Not a very, that's why we have used the word plant. It's a plant. Okay. So the basic introduction, which can help us in understanding material through the knowledge of pharmacy. I hope things are clear. There's nothing much to explain. You'll have to just keep the information in mind. Now, where I can explain, or what is more important according to me for a homeopathic student, is this area. Now, what is this? Sphere of action. Any wild guess what could be the sphere of action of Podophyllum? Very good. One of your friends says GIT. What made you think of GIT? Because I had given a case and we had already discussed a remedy predominantly affecting the lower bowel. Okay, good. So, before I take up the, the sphere of action, the objectives that I have set for today's class, a small remedy, and hopefully we should complete it within next 30-40 minutes. Mention the sphere of action and pathogenesis of Podophyllum is my first objective, very important. And second thing, from the image, I am giving you a clue that we are focusing on. Now what made you think of characteristic? Because there are so many symptoms which are common, and there is one which is peculiar or uncommon. So when Podophyllum was proved, patients came up with a lot of symptoms, or the doctors, they saw a lot of clinical symptoms. Fine? And then we decide what is common, what is uncommon. Okay? So that's very important, and many times in our clinical practice, We pick up uncommon symptoms and we prescribe. So this becomes very, very important, this area. And moving ahead, the third very important thing is we are looking at, yes, very good. But I mean, see, you should understand the terms. The more you get used to the terms, the more easy things will be. So we are looking at the particular symptoms. Nothing much to do with mentals. Though there are a lot of mental symptoms in Podophyllum, keeping the first year in mind, I am not going in detail about the mentals, like we did in arsenic, like we did in aconite. We are not going very much in detail. I will give you one or two. Okay. So describe, see, even under particulars, please note, even under particulars, I am not typically going from head to toe. Okay. I am focusing on the area that is important for you. As a student, and when you grow and become a practitioner, what is it that is important is what I am trying to focus. So if you just see here, we are looking at the liver, we are looking at the rectum, we are also looking at the female symptoms of Podophyllum. And again in the next session, I mean the next slide that I show, you will also realize that these three areas are very important. Okay, I'll just try to correlate a little later. And this, from the image, you know, we are looking at modality. Modalities include aggravation and amelioration. So modalities is what we'll be focusing. And the last thing, yeah, so wherever possible, you know, we'll at least recall the first year related remedies. Like beautifully a little while ago, you gave me a lot of remedies for diarrhea. Similarly, we'll see, as and how the PPT unfolds, what could be the other similar remedies that we can think of is what we're discussing. Any confusion with the objectives set for you? All clear? So we'll slowly take one by one. Okay. Now, the first objective, if you remember here, what is it? Sphere of action. So, we already got a clue that this remedy has an affinity for lower bowel. Yeah, GT, very good. So, what we are trying to understand is, we are looking at the sphere of action, mucous membrane. What is it? Podophyllum is acting on the mucous membrane of the GIT. Okay. Predominantly, it has an affinity for the duodenum. Okay, it has an affinity for the duodenum. It has an affinity for the lower bowel, and it has an affinity for the liver. If you remember, what did I tell you? Describe the liver, rectal and female symptoms of Podophyllum. Okay. So this is where it comes from. Liver, the intestines, and of course the rectum. Now acting on all these things, what will Podophyllum do? Okay, it increases the secretions. The bile secretions will increase. Okay, the intestinal secretions will increase. Fine. So it acts on GI and it increases the secretion, one. And I also tried to mention that it has an affinity for the liver, and even liver, it is physiology, you know, that bile produces what? Sorry, liver produces what? Bile. And bile has its own functions. We are not going there. But basic integration, basic understanding, liver as an organ and bile as a secretion. Podophyllum acts on liver and it increases bilious secretion. Bilious secretion. So what can you expect a little while later? So when bile secretion is increasing, what? Very good, beautiful, good. Jaundice. See, this is how slowly, boys, we'll have to start connecting the dots. So Podophyllum is acting on liver, it is increasing bilious secretion. So in blood, there is more bile. So when there is more bile in blood, then the condition is what we call it as jaundice. So small clues you will start getting. And this is how you have to study materia medica. N number of times I have told you, what did I tell you? Materia is a subject that should not be by-hearted. Materia is a subject that you should understand from your mind and of course from your heart. I am also using the word heart here because heart is what? I mean, you have a girl and you have a boy. If she has to indicate something, she wants, he or she makes some symbol. What is this? This is for love. Fine? Hope I am not discovering something because you are so silent. I mean, it's your generation thing. Fine? So what I was trying to tell you is, must be I made the symbol wrong. She's just, thank you. She's just correcting me. Nice, sir, this is not like this, I don't know, something she did there. So it's a different way of, that's why you didn't connect. He's showing different symbol. So what I was trying to tell you is, Material Medica is something you should read from here and also something you should be passionate about. Passion comes from heart. Fine? So please don't buy it. Oh, it has some buy, liver. No. Don't do that. If you do that, nothing gets registered. Whatever is getting registered is only for your exams. Exams के बाद आप भूल जाएंगे. ऐसा नहीं करने का, ऐसा मटीरियल मेडिका नहीं पढ़ने का. दिल से, दिमाग से. Fine? With a lot of enthu and with a lot of passion, you have to read this beautiful science, beautiful subject, material. Because entire life, this information is going to feed you. Entire life. Right? You never know when Podophyllum patient will come, you never know when arsenic patient will come to your clinic. But you should be ready. Okay? So let's keep things simple. Mucous membrane of stomach, GI, lower bowel, and of course we are talking of this. A second very important thing. It's also a remedy which has an affinity from your anatomy. Glands. Saliva. See, I have not only shown you parotid, I have also shown you sublingual and submandibular. Okay, so salivary glands in general. So it acts on the salivary glands and it increases salivary secretion. Okay, so you see more of salivation. And when you read mercury, the remedy mercury in future, you see mercury has so many symptoms Podophyllum is producing. And that is one reason Podophyllum is called as, what is mercury? Is it a plant, animal, chemical, mineral? What is it? A liquid metal. Okay. And what is Podophyllum? You saw the image. It's a plant. So Podophyllum is called as vegetable mercury. It can be a Viva question for you tomorrow. Name the remedy from first year syllabus which is called as vegetable mercury. And the answer is Podophyllum. Podophyllum. Okay. So it acts on GI, it acts on the salivary glands. So this is the spear of action. And of course it also has an affinity for the female genitalia, which I will be telling a little later. Okay. Before I move further, two small things we have spoken. And if you have any questions, please feel free to ask. What are those two small things we have taken? We have introduced a remedy by name Podophyllum. Common names: berry seed grown, brewer, Partius, family, spear of action, pathogenesis. Okay. Any good questions? All fine? We'll go ahead. See, because everything is linked. If you don't understand the first slide, second slide, you'll get lost. Kya bol rahe BK sir? So you'll not get connected. So please be connected and we'll look at the very important thing. What are all the causative factors? I hope 11 months being into homeopathic Materia Medica, you understand what ailments are. Correct, no? Fine. So what are all the causative factors arsenic had, aconite had, colchicum had, apis had, and what is the ailment that you are having in Podophyllum is very, very important. Okay. So ailments which comes from the image, ailments which comes during pregnancy. Okay. So what is that complaint a Podophyllum lady can have is she can have hemorrhoids. She can have hemorrhoids. Okay. Other remedies for hemorrhoids? Aloes, arsenic, apis, sulfur. Okay. Many more remedies. Right. So even if you forget hemorrhoids, first year student, it will not make big difference. But you should remember complaints during pregnancy. Complaints during pregnancy. Any other remedies? Complaints during pregnancy. Very good. Dull camera. When dull camera? Getting wet. What will happen when they get wet? Beautiful. Good. I am happy you remember. Arnica. What will happen in arnica? One second. Okay, very good. Yeah. One second. Let me finish arnica. One of your friends is in a hurry, jumping to arnica, sudden. Okay, no, I will come back to arnica. But having said arnica, you should also have a clarity. What will happen in arnica? So, arnica, after a blow, I told you, for example, a very pathetic scene. Drunk husband, kicking, blowing. It should not happen, but unfortunately when it happens and the lady is bleeding and there is a threat for the life of the fetus inside, threatened abortion after blow, after injury, one remedy you can think of is arnica. Now before I take up upon it, what else can happen in arnica during pregnancy? There is something very interesting in arnica. Dysmenorrhea. How will dysmenorrhea happen when she is pregnant? No problem. No, must be. No, don't laugh. Must be at something else. And dysmenorrhea came out. Right? No issues. See, you have all rights to make mistakes here, but don't make mistakes in your clinic because you are dealing with a patient. Life. Okay, good. She added something more serious. I wanted to keep it very simple. Then she said life. Then everybody will come over. But yes, seriously, we deal with something very serious. Fine? And we are dealing with life. Good. Appreciate. Now, what is that one more thing you have in arnica? Please focus only related to this particular image. Don't think something else. Focus like a horse, only here. Here means here. The image. What else you have in arnica during pregnancy? Now, what is the most happiest thing for a mother when she is pregnant? What is it? Parenting. Craving. Okay, very good. No problem. Yeah. She's again making it simple. Boss, I am pregnant. मेरे को पिज़्ज़ा ला. मेरे को नहीं, बच्ची पिज़्ज़ा मांग रहे हैं. पिज़्ज़ा. चलो, yeah. See, absolutely right. But let's not go there. But what I'm trying to tell is, the lady will have different cravings, and husband, mother-in-law, sister-in-law, they will not stop. Right? Okay? Because would-be mother, she is giving us a child. So 99%, all our grands are देखो जी मेरे को ये करना वो चलो Swiggy is about चलो so that's an advantage. Okay, other than the craving, movement लात मारते हैं ना. See, boys are telling and girls are sitting. ऐसा होता है क्या? Fitness में ऐसा होता है? Right? No. See, you would have watched many movies. Yeah. Always well. Okay. So you have that moment. This is what we call it as. I know you are first year students, and I will have some merits here. I can fake how intelligent I am because I am first year. But as and when you study, then you know how weak as are told in first year. What I was trying to tell is there's something called as quickening. It's a movement. That child movement. See, many times the mother becomes emotional, and many times she'll also call her husband. So like there is this movement happening, and mother gets excited, and husband, though you will not listen, he also get excited. Chal, baby बोल रहे कुछ हो रहा है अंदर, चलो, yeah. Not to disappoint the wife. Sometimes you will also really feel it. This is what we call it as movements. Very important. They got it right. Unfortunately, arnica, the movements are very painful for them. They are very, very sensitive to the movements of the fetus. Fine? Okay? So what was so exciting for the mother, for an arnica patient that becomes pain. You getting my point? What was so exciting for a mother, would-be mother, for an arnica it becomes a pain. So this is a natural phenomena, every mother is waiting. Fine? Always well. He is kicking, she is kicking. Mother is waiting for it. Din mein kitne baar? They are waiting. But that becomes very difficult for arnica. You are a first year student, but I don't know if I will get a chance to talk about arnica. It is something very important. Sensitive to normal impressions. कुछ समझ में आया ये statement? Sensitive to normal impressions. What is this? Baby kicking, is it normal or abnormal? Normal. Right? So in arnica patient, no, they become very sensitive. The muscles, everything in arnica is sore. The uterus is also expanding. Lot of muscle activity is happening in arnica, and she is not able to take that kick, that movement. She becomes very sensitive, painful. Doctor साहब, इतना दर्द हो रहा है, क्या दर्द हो रहा है? When the fetus inside moves, no, I feel so painful. कब बाहर आ जाएगा ये? Right? Is the inner feeling what arnica has. Okay, please remember, if you are lucky tomorrow when you start practicing and when you have a pregnant lady coming and telling, Doctor साहब, बहुत तंग कर रहा है, क्या कर बहुत तंग कर, Doctor साहब, हर movement ना is, I mean, it's so painful. I cannot take this pain. Right? Don't be shocked, don't give a lecture. ये pain, that movement says, fetus is alive inside, that movement, अपने क्या सासू माँ को दिखाओ, नहीं, आप homeopath हो, and please understand the feeling of the individual patient. इनको एक dose arnica देना, then she will start enjoying, because all that discomfort will go, and then she will become normal, sensitive to what is it, normal impressions. I am not getting the exact word, I just tell you, but what is normal? For arnica, they are sensitive to that. Okay, like for example, you know, once I had given arnica to a patient. See, generally we go to religious places, right? And what happens when you go to a religious place? Yeah, you feel calm, very good. You feel calm, you feel nice, you feel positive, right? And this lady, this patient of mine, she had been to Balaji, Tirupati. And Tirupati is a very powerful place, very divine place, right? So she went there, and after visiting the temple, she came back and then she had a lot of issues. सर दर्द होना, बाल झड़ना, बहुत कुछ हो गया. कब से हुआ? उधर जाने के बाद. लेकिन हम लोग उधर जाने के बाद क्या? What do you get there after you go there? You feel calm, you feel peace. बहुत सारा बोझ था मेरे सर पे. उधर गया मैं, वो टेंपल गया, वो चर्च गया, वो क्या बोलते हैं हम लोग, दरगाह गया, कहीं भी गया, and you feel better. But this lady, it was Kota. So there I had given her arnica. Sensitive to normal impressions. मैं थोड़ा बोलता हूँ ठीक से, okay? But this is the crux you should remember, okay? What is this? Mercury. And I just gave you a situation that this is a remedy which is called as vegetable mercury. So bad effects of mercury, bad effects of lifting. Any other remedies that you can think of? Bad effects of strain. Arsenic. Arsenic was more of mountaineering. Arsenic was more of strain. Yes, very good, physical strain. But here it is more of lifting. One remedy you should remember here is arnica. One more remedy you should remember here is restores. Nahi bolna, restores. There can be many more remedies. Arnica restores, overstrain, arsenic, overexertion. Here it is more of overlifting. Overlifting in Podophyllum will mainly cause rectal prolapse, will mainly cause uterine prolapse. Okay? Ruta is done? Yes, no? It should have been done long time. Okay, so Ruta. These are few remedies in which we can think of prolapse. Come complaints during summer. Complaints during summer. One more remedy is Bryonia, brackets में लिखना, Bryonia, Antimonium crudum. Okay, fine. Antimonium crudum. Diarrhea. Okay. And complaints during, look at the image, complaints during dentition. Complaints during dentition. Okay. Complaints after eating sour. I should have asked you this question. I'm not citric fruits. Okay, I'm not kept all fruits. You don't have banana here, you don't have apple here, you don't have papaya here. What I have selected from Google Images is, I have selected only citrus fruits. So complaints after eating citrus fruits. Orange kaya maine, musambi kaya, lemon or kiwi, whatever, any citrus fruit, and then I have diarrhea. The remedy, one remedy can be Podophyllum. One remedy can be Podophyllum. Okay. So in Podophyllum, after eating citrus fruits, the patient starts talking more, or he can become delirious. Okay. Done? Okay. So 6 causative factors I have mentioned here. The first one is pregnancy. The second one is mercury. The third one is overexertion, overlifting. Fourth is summer, dentition, and the last one, what you saw here, is citrus fruits. Any confusion? All good? We'll go ahead. Okay, chalo. Now, we are looking at the characteristic symptoms. Okay. First, very simple characteristic symptom we have here is, what is it that the image is telling us? Thirst. Good. So here, what you see is, Podophyllum is a thirsty remedy. Any other remedies which are thirsty? Aconite is thirsty, very good. Arsenic is thirsty. What is the difference? Very good. I see. You need not tell. One of your friends showed his hand. No. What is it? Arsenic, small quantities, small intervals, short intervals. Aconite. Why is that? This. Large quantities at large intervals. That's very good. And any other remedies you can think of? Any other remedies? Yes, Bryonia done, you said no, it's not done. No problem. Thirstless remedies? Apis, repeated apis. Percentilla. Okay. Gelsemium I will be doing next. There are thirstless. Sina, thirstless. Yes, Sina is thirstless. Good. Sina is thirstless. Okay. So, thirst for large quantities, if you again closely observe, I have taken a image where the person is drinking cold water. So Podophyllum will have thirst for large quantities of cold water. Okay. So moving ahead, you also have something very characteristic in Podophyllum, and that is alternating symptoms. What do you understand by alternating symptoms? If one is there, the other will not be there. Any remedy that we spoke? Dalcam. Very good. Dalcam. Good, keep it up. So, headache alternates with diarrhea. What is it? When there is headache, there will be no diarrhea. When there is diarrhea, there will be no headache. Headache alternates with diarrhea is one thing. And then you also have diarrhea alternating with constipation. Matlab, there is diarrhea and then 3-4 days is not passing motions, or you can have constipation. Diarrhea alternating with constipation. Okay, second. And third, I told you in the objective that we are also focusing on an area that is related to the female genitalia. And what did I tell you under ailments? What did I tell you under ailments? Prolapse. Yeah, good. Hemorrhoids also pregnancy. But more important was, you saw a lady lifting. And what did I tell you? After lifting, they can go into prolapse, uterine prolapse. Okay? So, uterine prolapse after overlifting, prolapse of uterus from overlifting, straining, or from constipation or after delivery. After delivery, there is prolapse of the uterus, podophyllum. Okay? Podophyllum. And again, focus, what could be the probable thing that you see here? Huh? Very good. Abdomen. What abdomen? Huh? What do you see? Almade?
During period cramps.
Okay, good. Possible. During periods cramps. Possible. Good. No problem. Anything else that you can interpret?
Pain.
Huh?
Pain.
How is pain? Good. Yeah, pain.
Pain is identified with hip.
See, but I want your attention on the position of her sleep.
Don't worry.
See, pain she could have slept anyway, no? She is lying on abdomen. Okay.
Amelioration by in that position.
Okay, possible. It could be amelioration, it could be aggravation. Good, no problem. But what is important here in Podophyllum, a pregnant lady. Please listen to the statement given in books, homeopathic books. A pregnant lady can sleep comfortably on abdomen. Huh? No, you are telling no, but it is told in the books. Huh? So, we'll modify, I'm happy you said no. We'll modify the statement, can sleep comfortably during early months of pregnancy. It makes sense? Yes? So, assuming she is 1 month, 2 months, 3 months pregnant, and she is comfortably sleeping on abdomen. This is Podophyllum. So, in clinic tomorrow, you have a lady who is pregnant and she says, sir, I am not able to sleep on any other position. And I am able to sleep only on abdomen. And मेरे को ये डर है, मैं pregnant हूँ. कुछ हो जाएगा. You are getting my point? Fine? Go back to the physiology of pregnancy that we will be studying. You know, till few months it is still a pelvic organ. Meaning, and only then it starts, it will start expanding and it will come up as the fetus starts growing. The uterus also will start expanding. Okay. But in early months it's still the pelvic, still there in the pelvic area. That's what you have to remember. Any confusion, you need more clarity, or you are clear? Boys, all clear? Fine. So what I want you to remember is, I'll just see if I have written. In early months of pregnancy, can lie comfortably on abdomen. The other remedy we also have is acetic acid. So in brackets you can write acetic acid. Okay. Now before I take up the next slide, any questions here? First thirst, second alternating symptoms, uterine prolapse, and one more symptom related to the lady, and that is can sleep comfortably during early months of pregnancy. Okay, so we'll move ahead. Now, what is it that I am trying to talk next? Good. So it is side. It is side that I am trying to talk. Okay. Podophyllum is mainly right-sided. Podophyllum, if you just see from your side, it is mainly right-sided. So it's a right-sided remedy, and what are all the complaints that you have with the right side? Right throat, meaning right tonsils, right ovary, right hypochondriac region gets affected in Podophyllum. So it is a right-sided remedy. Any other right-sided remedies? Very good. Epis mellifica. Okay, chamomilla. Epis. And somebody will be talking, I will talk to you about lycopodium in future. I have 3 more remedies from my side, Gelsemium, pulsatile and lycopodium. 3 big remedies, I will try my best to cover it. And one symptom, what is this? Fever. What remedies come to your mind? Fever? Aquanet, very good. China, yes, good. Cinchona. One more remedy for intermittent fever. Good, Apis. Cinchona, China, no problem. China, Cinchona, Apis mellifica, Aquanet, fine. Arnica, beautiful remedy for typhoid. Now what is special reduction in arnica. I'll just share a small case. I'm into homeopathic practice for last 26 years. I'm just giving you, don't worry about the years part, but it also becomes important because first time in my life, I had a child who had fever, and you know what was the beautiful pattern in the fever? Only the upper part is hot, lower part is cold. Okay, I would have got cases before, must be I would have missed it. But then the intelligent mother, no, she said, sir, कुछ अलग है मेरे बेटे में, क्या अलग है? सर देखो सर, जब आप टच करके देखो ना, ऊपर टच करो गर्म है, नीचे टच करो ठंड है. Okay? Only remedy in our material America is arnica. Beautiful, good. Why I am trying to tell you is, I took 26 years to prescribe arnica based on that particular symptom. So every symptom that you study can be handy sometime. It may not be immediate. इसलिए बोल रहा हूँ ध्यान दो, पढ़ो. Keep all the information in your mind. You never know when arnica will knock your head or knock your door. When China will knock your door. When apis will knock your door. We never know. But you should be ready. Let any patient knock this door. You should be ready to open and receive them and treat them. That confidence you should get. And from where will you get the confidence? From knowledge. If you don't have knowledge, then apis is knocking the door, you will not open the door. They will go to the next door and they will open. They'll knock. Okay? So, fever. Podophyllum has something to offer. And what is it that you have in Podophyllum is very important. See, fever which starts at 7 a.m. and during fever, there is great loquacity. Loquacity matlab? Yen loquacity andre? Talkative, good. They were talking too much. Jaasti maatadtare. Talking too much. Loquacity. Yava loquacity? During chill and heat. Thandi iruvaga, chali iruvaga, sheke iruvaga, fever stage alli, there is increased talking. And during sleep. And sleep during perspiration. So it can be a Viva question. Describe or mention the fever symptoms of Podophyllum. Okay? So this is what you need to tell. Intermittent fever, 7 a.m., increased talking, and during perspiration they go to sleep. Very important. Okay? So moving ahead, what is this trying to tell us? Very good, right? Hypochondrial region. Can you be more specific? Podophyllum. Where did you see Podophyllum acting? Liver. So, what is this gentleman doing? He has pain in liver, and what is he trying to do is, he is trying to rub. Constant rubbing with pain is what you have in Podophyllum. Constant rubbing and shaking the entire region of liver with hands. They keep doing like this. They keep doing like this. So this is what you have in Podophyllum, liver. Okay. Moving ahead, you saw this. Where did you see this image? Where did you see this image? Under Ailments term. Good, under Ailments term. Now what is it that you have? See, desire to press the gums together. Socho. Can you press your gums together? No. Or when can you press your, now you cannot press your gums together. हाथ में देना पड़ता है, ऊपर का नीचे का नहीं होगा. But when can you press your gums together? Before dentition. Correct, na? So what? See, this is very tricky. That's what they say. Irresistible desire to press the gums together during dentition. So lot of irritation, and child is pressing. So that's where you can think of this remedy. And if you are keen in brackets, you can mention one more remedy, and that remedy is phytoleca. क्या है? Brackets में एक remedy आना चाहिए, and that remedy is phytoleca. Irresistible desire to press the gums together. So these are the characteristic symptoms. You want a small break? 2-3 minutes? Huh? Follow up? No, I have taken permission from the next teacher. You want a break?